So today we will talk about the obstetrical examination. The steps involved in the obstetrical examination are inspection, palpation, and auscultation. Before starting the examination, first of all, you should introduce yourself to the patient, take informed consent from the patient, explain all the steps of examination to the patient, and make her comfortable, and always approach the patient from the right side, and the proper position is the supine position, while slightly tilting the patient towards the left side to relieve the pressure on the inferior in vena cava, and similarly expose the patient from zipsternum up to the pubic symphysis, for which you need a two gynae sheet. So the first step in the obstetrical examination is an inspection. An inspection look for the shape of the abdomen. In pregnancy, normally the abdomen is distended. Similarly, also look for the umbilicus, whether it is inverted or everted. Also look for any prior C-section done and its scar present in the lower abdomen. And also note any other surgical scar present, like scar of appendectomy or laparotomy done earlier. Also note for the linea nigra, which is a line of pigmentation present on the skin extending from the pubic symphysis up to the zippy sternum. And also look for the stria gravidarum, which are the pink stretch marks on the skin, and the stria gravidarum are the new stretch marks. And also note stria albicans, which are the older silver color stretch marks on the skin. And also note for any visible vein. Also check the skin contour, and also look for the visible petal movements, and similarly also note the movement of the abdomen with respiration. In female, the abdominal, the respiratory movements are thoraco-abdominal. Second step in the obstetrical examination is palpation. In palpation, first of all, warm up your hand, superficially palpate the abdomen for any tenderness, and measure the fundal height. And the fundal height is measured by palpating the fundus of the uterus with the ulnar border of your left hand from zipsternum downward, and stop where you feel the resistance. And at the point where you feel the resistance, it indicates the fundus, and mark that area. For measuring fundal height, we have two methods. The first one is inchy tape method, and second one is the finger method. And inchy tape method measure the distance between the pubic symphysis and the fundus of the uterus in centimeter. And 1 centimeter is equal to 1 week. Let's suppose if on inchy tape method the height is 10 centimeter, it indicates that 10 weeks of gestation. An anti-tape method is used when the fundal height is above the level of umbilicus. Second method is the Pengas method. At the level of pubic symphysis, the fundal height is equal to 12 weeks, whereas at the level of umbilicus, the fundal height is equal to 20 weeks. And in between the pubic symphysis and umbilicus, one finger is equal to 1 week. And above the level of umbilicus, one finger is equal to 2 weeks. And at the level of zipsternum, the fundal height corresponds to the 36 to 38 weeks of gestation. So at the level of zipsternum, the fundal height is equal to 36 to 38 weeks, whereas at the level of umbilicus, the fundal height is equal to 20 weeks, and at the level of pubic symphysis, the fundal height is equal to 12 weeks. Above the level of umbilicus, we use the Enchi tape method, and above in between the umbilicus and the pubic symphysis, one finger is equal to 1 week, whereas above the level of the umbilicus, one finger is equal to 2 weeks. The second one is the LEOPOLD maneuver. So the LEOPOLD maneuver includes four grips. The first one is the fundal grip, second one is the lateral grip, third one is the pelvic grip, and the fourth one is the pelvic grip. The first three maneuvers are performed while facing the face of the patient, whereas the fourth one maneuver is performed while facing towards the feet of the patient. So the first LEOPOLD maneuver is the fundal grip, and the fundal grip involves palpating the fundal area of the uterus abdominally with both hands, and feel whether the lie is longitudinal, transverse, or oblique. And similarly, the fundal gap also tells us about the presentation of the baby, that which part of the fetus is occupying the fundus. If you peel a hard, firm, and rounded object, it indicates the head. But if you peel soft, larger, and irregular fundus, it indicates the buttocks. And if the fundal area is empty, it indicates that the lie is transverse. The second Leopard maneuver is the lateral grip, and the lateral grip involves palpating the lateral abdominal areas, uh, that is the flank area, and it is performed while fixing one side of the abdomen with one hand and then deeply palpate the other side of the abdomen with the palm, and repeat it for the other side also. And the lateral grip tell us about which side of the fetus, on which side the fetal limbs are present, and on which side the back is present. If you feel smooth and firm outline, it indicates the back of the fetus. But if you feel irregular and multiple parts, it indicates that the limbs are present on that side of the abdomen. So the lateral grip tell us on which side the limbs are present and on which side the back is present. The third Leopold maneuver is the polygrip, and the polygrip involves holding the lower part of the uterus per abdominally with your right hand and move it to know whether the head is believable or not. And the polygrip tells us which part of the fetus is occupying the lower part of the uterus. So the polygrip tells us about the lie and the presentation of the baby, at which part of the fetus is occupying the lower part of the uterus, and either the presentation is cephalic or breech. So the fourth Leopard maneuver is the pelvic grip, and it is done while facing the woman feet. So put four fingers of your both hand on the lower part of the uterus abdominally along the inguinal ligament, and note whether your fingers meet in the midline or not. And the pelvic grip tell us about whether the fetal head is engaged or not, and how much of the fetal head is palpable abdominally. And similarly, the pelvic grip also tells us about the attitude of the fetal head, whether the fetal head is flexed or extended. So the first maneuver, which is the fundal grip, it involves palpating the fundal area of the uterus abdominally, and it tells us about the presentation and lie of the baby. The second maneuver, which is the lateral grip, it involves palpating the lateral areas of the abdomen to know on which side the fetal limbs are present and on which side the fetal back is present. And the third maneuver, it involves moving the lower part of the uterus with your right hand, and it tells us about the lie and the presentation. And similarly, if the presentation is cephalic, it tells us that whether the head is believable or not. And the fourth maneuver is the pelvic grip. It involves putting the forefinger of your both hand abdominally along the inguinal ligament in the lower part of the uterus, and note whether your fingers meet in the midline or not. If the fingers meet in the midline, it indicates that the fetal head is not engaged. But if your both hands finger they do not meet in the midline, it indicates that the head is gone down and the head is engaged. Similarly, this fourth maneuver also tells us about the attitude of the fetal head. Attitude means that the head is either flexed or extended. Now, the last step in the obstetrical examination is the auscultation of the fetal heart sounds. The auscultation is done with the help of Doppler, and it can be also done with the help of stethoscope. And the fetal heart sound are heard best on that side of the abdomen where the fetal back is present. And always check the fetal heart sound along with the maternal pulse to differentiate the fetal heart sound from the maternal one. Normally, the fetal heart rate ranges from 110 to 160 beats per minute. And similarly, the fetal heart rate can be also measured by the CTG. And CTG stands for cardiotocography. It tells us about the frequency of the fetal heart rate, and then similarly also tells us about the variation, acceleration, and deceleration in the fetal heart rate. So at the end, cover the patient, make her sit, and say thanks to the patient. So it was all about the examination of an obstetrical patient.